A seated variation for a posterior upper thoracic tender point can also be performed. We make our diagnosis of the tender point at the midline. So we're going to have our patient forward bend. We're going to palpate inferior to the spinous process of T1, T2, and we elicit a tender point response, and the patient says she has that tenderness, so we're going to tell her to remember that. We're going to call that a 10. We're going to have our patient take her arm, put her arm on her opposite shoulder, let her head forward bend, and now we can very gently control this patient. We have quantified that tender point as a 10, and now we're going to very gently put her into extension, have her take a nice deep breath in. As she exhales, I'm going to try to translate that into anterior extension to find the position where that tender point has been completely alleviated or as close to 100% reduction of the tenderness as possible. Once we find that position, there may be required a little bit of fine tuning, especially if the tender point is off the lateral tip. It may be off the inferior lateral tip on the left, therefore we might have to add a little bit of side bending right, rotation right, because we would have to extend and side bend away and rotate away from the tender point if it was located on the inferior lateral tip. We hold for 90 seconds. After 90 seconds, we have our patient take a deep breath and relax, fall asleep, take her back to neutral, and we can have her sit up straight, relax her arm. Our finger has not left the location of the tender point, and now we repress, and hopefully the patient says that the pain has totally resolved, or at least there is a 70% reduction of pain to determine the effectiveness of the technique. So a seated variation to treat a posterior thoracic tender point either in the midline or on the inferior lateral tip of the spinous process.